Facebook. And
hold on. Okay.
Yep. It's
you
there.
got it?
Yeah.
Okay.
And I just shared it.
Okay. And I'm sharing it now too. Okay, we're good. Well, thank you, Corrine Bradley, for doing this. Go ahead. And why don't you, Corrine, tell us why you decided to volunteer for such an event. I really appreciate you doing this.
I'm very happy to participate in this event. This is something that I am passionate about. I believe that especially the Black community needs more education about coronavirus and the impact in the daily life and just moving forward, especially in this age where testing is more available and people are going to try to get back to normal. So I'm very excited to hear what our doctors have to say.
Yeah, thank you so much, Corrine, because this was an effort that you put forth and it didn't just happen today. I just want to thank our frontline doctors for being here today, for answering the call to duty every day. One thing I know for sure is the coronavirus is like going into a burning building, and we know that firefighters are known to go into burning buildings to save lives. And we should thank our doctors here today for every day going into the hospital to help people. So I want to thank you, all doctors, for doing that. And I want to thank especially our Dr. Balark. And I want to thank our Dr. Joy West. And I also want to thank our Dr. Tomitra Latimer for doing this today and for everything that you do during this pandemic to help save lives. And so we should start right now and get started as to why we thought it was important to do this. There is a viewpoint from a Northwestern cardiologist by the name of Clyde W. Yancey. He's an MD, and he wrote something that is in the American Medical Association, and he wrote an opinion. And I think it sets the stage for why it's important for us to have this discussion. And he said, the U.S. has needed a trigger to fully address healthcare disparities. COVID-19 may be the bellwether event to do it. And so we know that Blacks and minorities have died at alarming rates compared to our peers. And so the doctors here wanted to make sure that they got the message out, and I'm so grateful to them. So let us go right now to Dr. Balark for a few words.
Well, Representative Ford, I am honored today to be able to present my information that I can share with the public as relates to COVID-19 and the African-American experience. And I want to thank you for giving me the opportunity to share this very important information.
And so who is Dr. Kimbra Bell Balark? What I know is that you, for one, people know you all over the United States. So we're lucky to have you right here on our platform today. And you are Dr. Kimbra Bell Balark, is an assistant professor of clinical medicine at Northwestern University Medical School and on staff at Northwestern Memorial Hospital. Dr. Bell is a board-certified internal medicine physician. She has also been appointed by Lieutenant Governor Juliana Stratton to the Justice and Equity Task Force for the state of Illinois, as well as the Equity Task Force at Northwestern Hospital. I want to also mention that we know that you have been appointed to the Illinois Diabetes Commission by the state of Illinois, the Secretary of Human Services, in 2008. So we thank you for the work that you do in the state of Illinois. And we have now Dr. Joy West for a few words.
Hello, Representative Ford. I also would like to thank you for giving me the opportunity to join my colleagues, Dr. Bell and Dr. Latimer, to share COVID information around pregnancy in particular. I have been a part of the COVID community since it first hit, and I'm happy to be here to share what I have learned and what we can do as a community.
And Dr. Joy West is a medical doctor, and she is a part of the FACOG. And that is, I had to look it up because I just don't hang out with doctors all the time. In fact, I do my best to only see a doctor annually when I need to. And so thank you for being here. Let me just tell the viewers and the listeners what the acronym stand for, or would you like to tell us what it stands for and why it's so important to be a fellow of the FACOG?
So the FACOG, the American College of OB-GYNs, in order to obtain board certification, there is some things that you have to do, including an oral exam and a written exam. And it simply means that I have attained the credentials to practice OB-GYN at the top of my game. So it is a way of making sure that I am delivering quality care to the OB-GYN community.
Well, I read somewhere where it says that if you are, if your doctor is of the FACOG, you can feel confident that you will receive the highest quality health care. And so that's impressive. Thank you so much. And let me just give the viewers and our listeners a little bit about your background. You're a native of the South Side of Chicago, where she currently practices what is that? I said it all night.
Obstetrics and
gynecology. So, and that is, you do that at Roseland Community Hospital and Mount Sinai.
Correct.
And you also are past medical staff president at Roseland Community Hospital, where you previously served as the chair of the Department of Obstetrics and Gynecology. And let's see what else we could say about Dr. West. You earned your bachelor's degree from where?
Augustana College in Rock Island, Illinois.
And before we go to our next doctor, I want to go back to Dr. Balark, because I didn't ask you if you were board certified. Are you board certified, or are you you're on mute? Could you tell us if you're board certified as an internist?
Okay, I didn't mute myself. So yes, I am a board certified physician, and I have been a board certified physician since I began my medical practice. So yes, and at the hospital in which I practice, you can only practice there if you are board certified at Northwestern.
So we could feel confident that you will, that your patients will receive the highest quality of health care at Northwestern as well.
Yes, sir.
All right. And how about if we go right to Dr. Latimer with a few words?
Good morning, and I wanted to thank Representative Ford and Corinne for this opportunity to speak to the viewers about COVID-19 in children. I'm a pediatrician, and I'm just happy to be here along with my colleagues, Dr. Kimbra Balark and Dr. West.
And thank you so much, Dr. Tomitra Latimer, MD, and you're a graduate of Cornell University, University of Michigan Medical School, and the University of Chicago. Right now, Dr. Latimer is an assistant clinical professor of Pediatrics at Northwestern University, Feinberg School of Medicine. And Dr. Latimer is also the medical director of Ann and Robert H. Lurie Children Pediatrics at Deming, a primary care clinic that provides care for patients that are underserved and have complex medical problems. And I guess the question that we have to ask you is, are you board certified as well, Dr. Latimer? And you're muted.
Yes, I'm a fellow in the academic pediatrics, and I am board certified. And I had to do similar activities to be able to provide the best of care. And like Dr. Balark said, Northwestern or Lurie Children's requires you to be board certified and maintain your certification.
Well, thank you, doctors. And I do know that it's very important, and I think that you guys provide a lot of hope and promise for young people and inspire them to want to be just like you all. So congratulations all that you've done to get where you're at today. And with that, we should just move right away to the presentations. And our first up will be Dr. Balark.
Thank you, Representative Ford. And one other thing I wanted to say, I did not mention where I attended medical school, and I graduated from Meharry Medical College in Nashville, Tennessee. So today, I would like to take a few minutes to discuss with you COVID-19, or SARS-CoV-2, its impact on the African American community, and finally, I would like to take a moment to dispel some common myths regarding this virus. The novel coronavirus, next slide please, is how this virus was initially referred to, as it was novel or new, meaning we had never seen this particular virus before anywhere in the world. COVID-19 stands for Coronavirus Disease 2019, as the virus was first identified in late 2019 in a province of China. The virus that causes COVID-19 is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome, Coronavirus 2. As you may recall, we had a much smaller pandemic in 2002-2003 known as SARS, or SARS-CoV-1, was very deadly as well, but fortunately did not affect nearly as many people. Now, there are 7 different coronaviruses, 4 of which are benign or harmless. As a matter of fact, everyone listening today has likely had a coronavirus infection, as it causes up to 30% of the common cold. However, 3 of these 7 coronaviruses are deadly, and 2 of those 3 are SARS-CoV-2 in the early 2000s, and now currently SARS-CoV-1 in the early 2000s, and now currently SARS-CoV-2, which is the virus responsible for the COVID-19 disease and the COVID-19 pandemic. The third one is MERS, M-E-R-S, the Middle Eastern Respiratory Syndrome, and it was first reported in 2012 in Saudi Arabia. Lastly, as you can see in this commonly seen image of the virus, the spike-like projections are similar in appearance to a crown. Corona means crown, thus the name coronavirus. Next slide, please. Now, many have asked, where did this virus come from? The origins are believed to be from a particular species of bats in a province of China. It is felt that these bats may have infected other animals, and then there was animal to human transmission. As is depicted in this schematic, this is thought to be the case for SARS, MERS, and SARS-CoV-2, which is the virus that caused COVID-19. Next slide, please. COVID-19 is known to be transmitted primarily by respiratory droplets secondary to sneezing, coughing, or simply talking. If these droplets come into contact with the mucous membranes of the eyes, nose, or mouth, the disease can be transmitted. It is also potentially transmitted, though less commonly, by touching objects that may have the virus on them, where the virus could live up to several days. So if one were to come into contact with these items, such as a door handle, and touch their eyes, they could potentially become infected. Symptoms can manifest differently in different people. Some persons may experience mild disease that may only consist of a cough or sore throat. Others may experience fever as high as 102 to 103 degrees, extreme fatigue, and severe shortness of breath. And ultimately, these persons may require mechanical ventilation in the intensive care unit, where they tend to suffer from a severe viral pneumonia. It is believed that some individuals may be asymptomatic, meaning that they do not exhibit any symptoms. But if they were to come into contact with a vulnerable individual, and vulnerable meaning a person with diabetes, heart disease, lung disease, severe obesity, asthma, or age greater than 65 years old, that person's disease course could be life-threatening. In general, 80% of individuals who contract COVID-19 will have mild to moderate disease and will recover at home and not require hospital admission. However, 13% will have severe disease requiring hospitalization, and 6% will require mechanical ventilation in the intensive care unit. So the odds are in the favor of most people of having a favorable outcome, but regardless, caution is strongly advised. Next slide, please. This schematic demonstrates how we prevent transmission, use of masks or face coverings. So if two people are interacting, one COVID positive on the left and one COVID negative on the right, if neither is wearing a mask, obviously risk of transmission is very high. If the COVID negative person is the only one wearing a mask, there is still a high risk of transmission and that the uninfected person will still become infected. However, if the COVID positive person is wearing the mask and the COVID negative person is not, the risk of transmission drops dramatically. Furthermore, if both persons are wearing a mask and we include social distancing of at least 6 feet, if not greater, the risk drops even further. And finally, if the COVID negative person is in his house and the COVID positive person is outside, the risk is 0. Next slide, please. In addition, social distancing of at least 6 feet and frequent hand washing is important with warm water and antibacterial soap for at least 20 seconds and or the use of an alcohol-based hand rub, aka hand sanitizer, that has at least 60% alcohol. Ultimately, washing with soap and water is preferred. Next slide, please. So just for further clarification, when you wear your mask, you are protecting others in case you have COVID-19 and do not know it. When others have on their mask, they are protecting you from COVID-19 in case they have it and do not know it. Many persons mistakenly believe that by wearing my mask, I'm protecting myself from getting COVID-19. Well, this is partially true, but the primary benefit of you wearing your mask is that you are protecting others from getting the disease in case you have it and do not know it. Next slide, please. Face covering recommendations. So who should wear? Individuals older than 2 years of age in public settings. Children who should not wear are children under the age of 2, anyone with trouble breathing or unconscious, incapacitated, or unable to remove the mask on their own. How to wear. Wash hands, then put it on over your nose and mouth and secure under your chin. It should fit snugly on the sides and make sure you can breathe easily. How to remove. Handle only by the ear loops or the ties. Fold your outside corners together. Place in a storage bag. Wash your face covering after every 3 days or so of use, more frequently if preferred. Wash hands immediately after removing. Next, I would like to transition into, next slide please, COVID-19 and Black America. Next slide please. COVID-19's devastating impact on African Americans. Depicted in this slide are 4 states, Louisiana, Illinois, Michigan, and North Carolina, as well as the city of Chicago. The date of this data was April 6, 2020, and I wanted to point out the state of COVID-19 in our country as of this date during the heightened portion of this pandemic. If you take a look at the first bar, Louisiana, in the blue shading represents 32% of the population in Louisiana that is African American. The red bar indicates that 70% of the deaths from COVID-19 were African American, though we only made up 32% of the population. And a very similar statistic for the city of Chicago. 30% of Chicago's residents are African American, yet 70% of the deaths in Chicago from COVID-19 were African American. Next slide, please. So why such the disparate impact on Black and brown people? In part, this is largely related to something known as the social determinants of health. Social determinants of health are conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risk. So when we think about these things, individuals with access to resources, money, and power in general tend to do better navigating the twists and turns of life. Black Americans make up about 36 million persons, or 13% of the United States population. Blacks, relative to whites, are more likely to live in neighborhoods that lack healthy food options, green spaces, recreational facilities, lighting, and safety. Blacks are more likely to live in densely populated areas, which increase their potential contact with others. Blacks represent about 25% of all public transit users. Blacks are also less likely to have equitable healthcare access. We are more likely to be a part of the essential workforce, where we represent nearly 30% of bus drivers and nearly 20% of all food service workers, janitors, cashiers, and stockers. During a highly contagious pandemic like COVID-19, Black workers and consequently their families are overexposed. In addition, Blacks are disproportionately affected by the conditions that are considered to be risk factors for a very severe COVID-19 course if they were to contract the infection. These conditions include diabetes, chronic kidney disease, chronic lung disease such as asthma and COPD, immunocompromised liver disease, and severe obesity. The impact of COVID-19 has shed a very disturbing light on chronically and deeply embedded disparities in the Black community that must be addressed. This has resulted in the development of numerous work groups and task force and think tanks throughout this country, which will hopefully help us to address these disparities and promote a future with greater equity. Next, I would like to take a moment to dispel a few myths surrounding COVID-19. Next slide, please. Can regularly rinsing your nose with saline help prevent the infection with the coronavirus? No, there is no evidence of this being true. Next slide, please. Can eating garlic help prevent an infection with the coronavirus? Yes, garlic is a healthy food that may have some antimicrobial properties, but no, it cannot help prevent infection with coronavirus. Next slide. Does the coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Next slide, please. Are antibiotics effective in preventing and treating the new coronavirus? No. Antibiotics do not work against viruses, only bacteria. Next. Are there any specific medications to prevent or treat the new coronavirus? To date, there are no specific medications recommended to prevent or treat the new virus. However, since the development of this slide, the antiviral drug remdesivir is showing a lot of promise for treatment. Next slide, please. 5G mobile networks do not spread COVID-19. Viruses cannot travel on radio waves or mobile networks. And COVID-19 is spreading in many countries that do not even have 5G mobile networks. Next slide, please. Drinking alcohol does not protect you against COVID-19, and it can be dangerous, actually. Next slide, please. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the coronavirus, or any other lung disease for that matter. Next slide, please. You can recover from the coronavirus disease. Contracting this disease does not mean you will have it for life. Next slide, please. Exposing yourself to the sun or to temperatures higher than 25 degrees Celsius does not prevent the coronavirus disease. Next slide. So in closing, for your consideration, let's use the example of watching a baseball game from behind a fence. Equality is when we're all given the same foundation or the same footing, despite the fact that we may still not have what it takes to see the baseball game beyond the fence. Equity is when our individual differences are taken into consideration and we are each provided with what we need to be able to see the baseball game beyond the fence. And liberation is when the fence is removed. Next slide, please. Thank you.
That's fantastic. Thank you. And now we'll go to Dr. Joy West.
Thank you, Representative Ford. Again, I'm honored. It's a privilege to be here with you and with our community to share my thoughts and what I have learned along the way regarding the COVID-19 pandemic and pregnancy. We are at war with this virus, and it is critical that we stay focused and that we fight back. I want to say that the pregnant patient is the one of the vulnerable members of our community, and we want to make sure that the future of our community and our pregnant women carry the future of our community. We want to make sure that they are provided with information before, during, and after the pregnancy. Next slide. So it's important that we all know that quality care, even during this COVID pandemic, is a right that every woman has. And even with all that is going on around us, everything about pregnancy, from the beginning of the pregnancy, the prenatal care, during childbirth, postpartum, all aspects of prenatal care need to be continued at the highest quality of care. Pregnant women, again, carry our future, and in order to make it through this pandemic, we need to make sure that they are receiving the care that they need. Next slide, please. So the question becomes, with the COVID pandemic, with the virus, are pregnant women at any more risk than anyone else in our community? Currently, there is no data that shows that pregnant women have greater risk. So again, we have not seen that the COVID-19 virus gives pregnant women any more severe effects or outcome. We do know that during pregnancy, a woman's body is a little bit more immune to respiratory infection. So it's important that all of the precautions that Dr. Balark has just reviewed, that pregnant women make sure that they are taking those precautions. Next slide, please. So how can pregnant women protect themselves against the coronavirus? As Dr. Balark says, those precautions include the same precautions for everyone else: washing your hands frequently, avoid touching your nose and face, social distancing, and also, of course, with coughing, sneezing, you want to make sure that you are coughing or sneezing into your elbow. And a critical point here is seeking early care. If you have any of the symptoms that have been outlined, we don't want pregnant women or anyone in our community to wait too long. We want early care for our patients. Next slide, please. A lot of women have asked, what are the risks to my pregnancy? And what are the risks to my baby with the coronavirus? We still don't know a lot about the coronavirus. There is still a lot of data coming out. It's only been a couple of months, so women who have gotten pregnant early on or may be in the mid portion of the pregnancy want to know, will my baby be affected if I am positive for the coronavirus? What we do know is that to date, there have not been any studies where the baby has been infected by what we call a vertical transmission, meaning that the virus was passed through the amniotic fluid or breast milk even to the pregnant mom. We do know also that a newborn can be infected, though, if the newborn is around a person with the coronavirus infection. So it's important that we continue the safety precautions. There's still a lot of data that we will need from researchers. We're still early in the virus, but the good news is that we don't have any evidence at this point that the virus can be passed from mom to baby while the mom is pregnant. Next slide, please. Some of the questions that have been asked around the birthing experience is whether or not a mom who is COVID positive may breastfeed. And again, we're still doing research to determine the best way to interact between a COVID positive mom and her child. At this point, we are saying that a COVID positive mom may breastfeed. However, she should practice respiratory hygiene by wearing a mask and, of course, washing her hands before and after touching the baby, and routinely clean and disinfect all surfaces around the house. But again, we know that breast milk is the best milk, and we want to encourage pregnant moms to bond with their babies and give their babies the advantage of starting off with the breastfeeding. Next slide. In childbirth or in labor, we want to make sure as obstetricians and gynecologists that all women, COVID positive, COVID negative, are treated with respect and dignity. On our labor and delivery units, the American College of Gynecologists have made it quite clear that we want to make sure that our patients are comfortable. We are allowing a companion to be there with the birthing mom. We're encouraging our mothers to communicate with the staff all of their needs. Some of the adjustments that we have made on the labor and delivery unit include offering early epidurals, even to make sure that we can avoid general anesthesia if necessary. We are in communication with our patients, and we're asking our patients to be open about their desires, even if they are COVID positive. We know, as Dr. Balark said, there's a lot of asymptomatic patients, and so patients can have symptoms, cannot have symptoms, be positive, feel perfectly normal. We want to allow that positive birthing experience, even for the COVID positive moms. Next slide, please. The question about maternal mortality is very, very important. Black women, studies have shown, have 4 times the rate of dying in childbirth than white women. This is a crisis in the United States, and many of you may have heard about Black women dying in childbirth. This is very real, and it is alarming. The COVID-19 epidemic has only magnified what we know are healthcare disparities which predispose Black women to die in childbirth. And some of those things, as was mentioned earlier, are the social determinants of health. Black women are dying in childbirth because of lack of access to quality prenatal care, quality intrapartum or labor and delivery care. We know that in order to have a positive birthing experience, we have to have some basic things like housing, jobs, income, good food. Access to quality care is necessary in order for us to decrease the rate of women who are dying in childbirth, and also the impact of the coronavirus on the Black community. We want to also identify one of the reasons why Black women are dying in childbirth, and provider bias when women are getting to the hospital in childbirth. We know from Serena Williams, for example, she mentioned her childbirth experience. Beyonce mentioned that they had difficulty being heard as Black women, having their needs met as Black women. So there's room for all of us to encourage African-American women to make sure that their voices are being heard. We need to, as providers, as physicians, be culturally sensitive to the needs of Black women, particularly in labor, particularly during the COVID-19 pandemic. The next slide, please. I want to take a minute to talk about testing. I'm very passionate, Rep. Ford, and we talked about this a little bit. Testing right now in this pandemic is critical, and people want to know, why is there a need for testing? I haven't gone anywhere. I'm staying at home. Why do I need to be tested? We know that the vast majority of folks who are COVID positive have no symptoms. Testing will help to identify the asymptomatic carriers of the virus that may be bringing it home to family members who have those comorbidities and who are at risk for having a devastating outcome. So the why of the testing is to identify the asymptomatic carriers mainly. Of course, if you're having symptoms, you need to be tested. But for us to really flatten the curve and for us to really put an end to the virus, we need to get more robust testing. This virus is cunning and it's ubiquitous, meaning it is everywhere, and testing will help us to identify who needs to quarantine and stay in place. There are 2 types of tests there are more than 2 types of tests. Right now, there are 2 tests that are being offered. One is the nasal swab, which is really testing for the actual virus. And the nasal swab can be either nasal or nasopharyngeal, where the swab is placed to the back of the nose, or nasal to the front of the nose. And then the second test is the blood draw, which is where we're actually testing for the body's response to the virus, which is the production of antibodies. So the two main tests that are being offered right now are the nasal swab and the antibody testing, which is the blood draw. We have heard so many reasons why a lot of folks in our community are reluctant. They're skeptical of testing right now. And we understand that there's a mistrust in our community of public healthcare systems because of the way African Americans have been treated in the past. But we know that the stakes are high right now, and we have to get past that to get to the point where we are being tested. There are testing sites that are provided throughout the city of Chicago, throughout the state of Illinois. For some, there are barriers to testing, such as, you can't get tested unless you have symptoms, or you can't get tested without insurance. There are sites that are offering free testing. There are sites that are offering convenient hours. And I think Rep. Ford, you're going to speak to that a little bit later on, but I want to just encourage members of our community to get tested. Next slide, please. And finally, I'd like to end with the impact of the coronavirus pandemic on our mental health. We are all very stressed out. This is a heavy, worrisome, fearful time for all of us. And we have every right to feel afraid right now, but we can't let that fear paralyze us. We can't let that fear keep us from moving to action, whether it may be testing, whether it may be developing coping mechanisms such as going outside just to get some fresh air. We want to, as physicians today, to let all of our community know that we are here to listen to your mental health concerns. And it is perfectly fine to say, I'm not okay. I need to talk with someone. I need to talk to a friend. I need to talk to a healthcare provider. There are national agencies. The National Alliance on Mental Illness, or NAMI, has representatives who are always ready to talk. We have to take the time to take care of ourselves and our community during this COVID pandemic. And finally, I want to say that for our community who may have tested positive, we want to say that the stigma around positive testing is very real. We understand that, but we have to get past that. Being COVID positive is not a death sentence. As mentioned by Dr. Balark, the vast majority of patients have no symptoms or will recover from the coronavirus. This is a time to address our individual needs and the needs of our community. Thank you, Rep. Ford, and I'll hand it over to Dr. Latimer at this point.
Yeah, and for those that have just joined us, I want to just say that today's conversation is on the novel coronavirus and the impact on people, with a focus on African American communities, pregnancy and mental health, and children as it relates to COVID-19. And I want to thank Dr. Balark for her impactful information that she gave, and also thank Dr. West for her impactful statements, especially on mental health during this time of COVID-19. And we should go now to Dr. Latimer for her presentation. Thank you.
Thanks. Good morning, and thank you for this opportunity. My name is Dr. Latimer, and I'm a pediatrician, and we're talking about COVID-19 in children. Next slide. So symptoms of COVID-19 in children are very similar to adults. Fever, cough, feeling tired, headaches, diarrhea and vomiting, which are very similar to the flu, but we know that this is not the flu. And also, children can have no symptoms. We're not quite sure how many, because we're not doing testing, as Dr. Balark and Dr. West have mentioned. But we do know that children tend to have If they are infected with COVID-19, their symptoms tend to be mild or no symptoms. The concern is when children don't have any symptoms, they're asymptomatic, then they're likely to shed the virus to those that are at risk, like those that have chronic medical problems and the elderly. Children are less likely than adults to experience fever, cough, and shortness of breath. And again, most children have mild or no symptoms. Next slide. This graph, dated from May 21, looks at the percent of children with COVID-19. One underlying or overarching point is that the information and data that we're getting around COVID-19 changes by the week, day, and sometimes by the minute. And so the total number of cases right here, May 21, was 1.28 million, but of course we know that number has gone up. But the percentage of children with COVID-19 has remained about the same, 3.7 to 4.2. Next slide. This graph is the shape of the US. Let me just orient you. On the left is California, and on the right is New York City. And those states that are deep purple represent the states with the highest number of COVID-19 in children. And Illinois is one of them. Next slide. This slide, again from May 21, is just another way of saying the same thing, that children represent a pretty small amount of cases of COVID-19. Overall, percent of children is 4.2, but there are multiple states that are reporting 5%. Illinois is one of them, it's about 6%, but then there's some states, including New York City, that has less than 3%. Next slide. So again, children do very well when they do get infected. They tend to have mild symptoms, but unfortunately, some children do require hospitalization. 0.4 to 2.1% of children require hospitalization, and there have been reported deaths, but thankfully that number is very small, 0.6%. And indeed, some states, many states are reporting zero deaths. The risk factors for severe complications requiring hospitalizations are infants less than 12 months of age, children with complex medical problems like asthma, children born with heart defects, children that are obese, and we're not sure why that is, as well as children with cancer and other problems of the immune system. But the majority of children, 55% or more, have either mild symptoms like fever, fatigue, or muscle aches, or no symptoms. Next slide. Now we're talking about multisystem inflammatory syndrome in children, or MISC. Perhaps you've heard about this or read about it, heard on the radio. It's a syndrome that was first reported in the United Kingdom and then was reported in other states, especially New York City, which had the highest number. Other states have reported, including Illinois. And I know this slide has a lot of information. I'll just break it down. We are learning lots more about this syndrome, but the criteria to make the diagnosis is children and adolescents under 21 years of age, laboratory or blood test evidence of inflammation, and these are blood tests that you obtain in the blood. Inflammation is what we describe as swelling. These children are really sick, so they require hospitalization. And then greater than two or more organs are involved, like the heart or the lungs or the blood. And then the medical team has kind of crossed out other signs or causes of this illness, like sepsis, which is serious infection of the blood, bacterial infection of the blood. These children with this syndrome are positive for COVID-19 or antibody positive for COVID-19 or have been exposed to COVID-19 within the last 4 weeks. Next slide. Some signs and symptoms of MISC: fever, and especially prolonged or persistent fever. They can have rash or swollen hands and feet, red eyes. They can have diarrhea and really severe abdominal pain or a belly pain, but some really concerning symptoms that warrant hospitalization for greater monitoring is low blood pressure or shock, inflammation of the heart, and this is swelling that involves really all the layers of the heart, so the lining of the heart, the vessels, and veins of the heart, and valves. Children can go into kidney failure and need a ventilator to help them breathe. But again, the majority of children do very well, and this is a very rare syndrome, and we're not quite sure what are the risk factors. We're still learning a lot. The treatment for this is hospitalization, IV fluids, monitoring, and steroids. And so an important thing to note is most children do well. If parents have concerns, then please call and talk to your pediatrician. Next slide. So what can children and adolescents do? And I think this is another underlying thing that has been discussed with Dr. Balark and Dr. West slides. Children can and should make sure they're washing their hands. Soap and water is just fine, or hand sanitizer. Cover your cough by coughing into your elbow. This is advice that we were recommending during the cold and flu season. Children should wear a mask, and if you're 2 and over, should wear a mask and try not to touch it. However, children that have intellectual or developmental disabilities, if it's a problem and it makes it challenging or difficult for them to tolerate the mask, then parents can throw over a thin cloth or blanket. The parents and children should clean and disinfect high contact areas like toys and practice social distancing. And parents can help ensure this is happening by modeling this very behavior. Next slide. What else can parents do? Parents can keep their children safe by keeping up to date with their well child checks and vaccines. Understandably, parents are not taking their children to the clinic as frequently for their well child visits and checkups, and they're even not going to the emergency room or the immediate care if their child is ill. Experts like the CDC, unfortunately, have noted a significant decline in immunization rates, leading to a real concern that we're going to have an outbreak of vaccine preventable diseases like we've seen in the past, involving measles or pertussis, which is whooping cough, to name a few diseases. And well child care checkups are not just for shots, but it's a way to ensure that your child is growing and meeting their developmental milestones. And given these really stressful times, it's an opportunity for the physician to make certain that they're looking and assessing for mental and behavioral health, which is what Dr. West mentioned. These visits are most successful when performed in clinic, and clinics are taking all necessary precautions to keep patients, families, and staff safe. Next slide. Other things that parents can do is encourage physical activity and playing. Bike riding is a very popular activity. The bike is a hot commodity right now, and so bike riding is a great way for the family to explore Chicago in a safe way, wearing your helmet, and practice social distancing. In fact, with fewer cars and with the mayor opening up some streets, it's a safer activity for children and families to engage in. Families can have a fun time playing board games. It's a great way for families to participate and play together. There's walking and dancing and reading for fun, all the while limiting screen time. Next slide. Parents should also be really mindful about keeping a regular schedule. When I see children and adolescents in my clinic, I ask them, how are you doing? And what's your day-to-day like? And they say, I'm really bored. And then you ask them, what are you doing? And they're going to bed at 2 or 3 in the morning and waking up whenever and skipping meals and eating really late and just spending lots and lots of time on their cell phone. And ways to mitigate boredom is to develop a schedule. And in fact, older children can be included and should be included. And they are that can be an important part of establishing what their schedule is going to look like. Screen time should be included on that, but making certain that you have chores and school and play. This can help alleviate boredom, and it's also having a schedule can help, especially, it's super important for those children with special needs like autism, children on the spectrum. Having a routine helps promote healthy eating and sleep. Next slide. Parents can help relieve stress and anxiety by first acknowledging it or looking for it, and then doing ways to help relieve stress and anxiety. These are really troubling times for children, and we know for adults as well, but they're missing their friends, and they miss their teachers, and they miss their school. They miss their sports and activities and prom and graduation, because virtual graduation is not the same. So the first thing that parents and caregivers can do is just to label what's happening. Acknowledging what's going on is valid. It can be very validating. And then parents should really try as best they can to own and resolve their own anxiety. And we know it can be significant, as Dr. Balark and Dr. West have mentioned. Their parents are dealing with food insecurity or housing or unemployment. So trying best they can to address those, and guiding their children to engage in mindfulness techniques. And parents can help with that too, with deep breathing and yoga. And there's a lot of really fun and interesting resources online. And then predictability. This goes back to routine. Predictability in a routine is very important in decreasing anxiety as well as depression. Next slide. And finally, what are clinics doing to keep children healthy? This is not my clinic, Lurie Children's Pediatrics, but this does give you an idea of what my clinic is doing and others. There are posters, signs posted that remind families and patients to practice social distancing and sit 6 feet apart or stand 6 feet apart. The waiting room has been removed chairs so that there's a lot more space to navigate and be able to practice social distancing. The rooms are separated, so well children are on one side of the clinic and children that are sick with fever or cough are on another side. We are cleaning and disinfecting before and after patients, high touch areas, and staff, patients and family are wearing masks. And so this is a way to let families know that it's safe to come to clinic. We are taking every precaution to keep families safe, and it's super important that children remain up to date with their vaccines and well child visits. And we're ready to take questions. Thank you for your time.
Thank you for that important, passionate presentation, Dr. Latimer. I think that your patients are lucky to have you when they come in. The children must love you. So let me just thank all of the doctors. Let me start by thanking Dr. Kimbra Balark. And if you missed it, she is an assistant professor of clinical medicine at Northwestern University Medical School and on staff at Northwestern Memorial Hospital. And she is board certified as an internal medicine physician. And we also want to thank Dr. Joy B. West, a medical doctor and a member of the FACOG. And she is on the medical team at the Roseland Community Hospital and Mount Sinai Hospital. And she's with OB-GYN. How about that? I'll just say it that way. And then we also have a big thanks to Dr. Tomitra Latimer from the, she's a clinical professor of pediatrics at Northwestern University Feinberg School of Medicine, and she is the medical director at Ann and Robert H. Lurie Children's Hospital. And so we want to thank you all for that. And I think that we can open it up to questions. I do have a few questions before we turn it over to our partner here, Corinne. And one, the question that I'll ask Dr. Latimer, and that is, I think that you said that, you know, there's this severe pediatric disease, and I think it's called MICS or something you did a presentation on. Is it true that that your hospital, there are no cases there of children with the disease?
So the syndrome is called MISC, or multi-system inflammation in children, syndrome in children, multi-system inflammatory syndrome in children. And there are cases in Illinois. I'm not quite sure if there is a case at Lurie Children's, but there are cases in Illinois, but this is still a very rare disease. Again, for the most part, just want to underscore, children, if they do become infected with COVID-19, either have very mild symptoms, a fever, cough, or being tired, or no symptoms.
Thank you. And my final question, there are a lot of questions, but we want to keep it compact. And this one is pretty simple. You know, during the COVID-19 pandemic, what motivates each of you doctors to get up every day to go into your workplace? We'll start with Dr. Balark.
Yeah, so as I said earlier, I'm a graduate of Meharry Medical College, and one of our motto that was indoctrinated into every graduate of Meharry Medical College is service of God, serving God through serving mankind with our healthcare abilities and talents. And so I consider it to be an honor and a privilege to do what I do in serving my community and those people around me. And in practicing my craft, I'm serving God by doing that. And so during these times of COVID-19, when I look at what I can offer through my talents and treasures as a physician, it's a given that I'm going to do whatever I can do to help my fellow man.
We'll go right to Dr. Latimer with the question, what motivates you every day to go to work?
I love being a pediatrician. I love my job. And I'm gratified to work in a clinic that provides care to all children, but especially children that are underserved, so like Medicaid, and children that have special needs. And it's been very great to see. I take care of newborns and then I watch them grow and develop and thrive, but I've also really gotten to know their families, their parents as well, and develop great relationships. And so it's inspiring to see parents that are really struggling even before this COVID-19, really try to do their very best to care for their children and try to make them happy. And lastly, it is very gratifying and rewarding to come to work and work alongside my colleagues that are like-minded, and not just fellow doctors, but nurses and medical assistants and those at a front desk, really just the whole entire medical team that has a working toward a shared goal of just providing the best care for children, regardless of what's happening in the world, whether it's a pandemic or not.
Thank you, Dr. Latimer. And what about you, Dr. Joy West? What motivates you and gives you the strength to continue during this pandemic, and even when there's no pandemic, you know, to be a doctor and to help save people's lives and to help people live a healthy?
Well, I'll be quite honest, Representative Ford. This is a tough time to be a healthcare provider. This is a difficult time to be a doctor. But I know that I have been gifted with the talent to be a physician. And this is the time, if there was ever a time, to use that talent to take care of my patients. I am motivated most by the fact that our people, mostly on the south side of Chicago, who are being hit hard by this virus, need my talent. They need the talent of African-American physicians. The majority of the doctors who are taking care of the underserved are African-American doctors. This is our time to step in to do our part. So I'm motivated by the fact that I have been gifted with this talent, and this is the time for me to use it. I'm motivated by the fact that I can kind of feel the pride of the ancestors, knowing that we are here as African American physicians to take care of our own.
I think that we're going to turn it over to Corrine. I don't know how many questions are we prepared to ask questions? Can I ask one more question? Or should we go, let's go right to, I see your, let's go right to Corrine.
We actually did get a question from one of the participants, and they actually had a question about resources for children in virtual mental health awareness. And I'm sure that we can extend that just to people of color who are struggling mentally during this time.
And so everyone, whoever wants to take that should go right ahead.
I'll take that first. There are a lot of resources. I'll just name two, but I'm happy to provide that viewer some different links. But two sources: the University of Washington has information on mindfulness techniques, and then Goes In. It's an organization that helps children manage their anxiety. But again, I'm happy to provide other resources as well. Also, your pediatrician is a good resource too.
Fantastic. And if we'll get those and link them to make sure that everyone visiting Representative Ford's page can have access to all of that. We do actually have another question that has come in. Someone has asked, do you have plenty of PPE in your practices? Do you feel that you are safe from contracting COVID-19? And they wanted to thank you all for your service.
So I can start with that one. So yes, we do. I will say that earlier on in the pandemic, as we all saw in the news, that there were fairly significant shortages as relates to PPE, but we do have plenty of PPE at this time. And yes, we do feel safe, at our place of work at the hospital and in the clinics. So right now, yes, we are properly equipped. Thank you for the question.
And I'll respond as well. At Roseland Hospital and Mount Sinai Hospital, we do have sufficient PPE. Roseland Hospital is particularly a vulnerable hospital. We have been unstable financially for a very long time. However, we recognize that it was important that the doctors and the nurses have what they needed to take care of the patients. So we have sufficient PPE for now. I made it a priority. I will not put my health on the line by providing care without PPE. So for now, we're okay, but we could always use additional resources.
Okay, and then we do have another question that has come in from Facebook. Someone wanted to know, where should a parent take their child if they suspect COVID infection, the ER or the clinic?
Take that. So at Lurie Children's Pediatrics and my clinic, Lurie Children's Pediatric at Deming, we encourage families to call first, please. And what we do is we have a COVID-19 hotline that we can then refer the patient to this hotline. And they're usually very prompt at returning the parent's phone call. And then they get information about the symptoms and they can schedule an appointment. We have testing at Lurie Children's, the Clark and Deming location, which is in Lincoln Park. We also have testing at the downtown location, 225 East Chicago, and I think we have another location out in the suburbs. And so we are encouraging families to call, and sometimes the physician can put in the order as well. And this is all in the effort of keeping the patient and family safe, and also staff and other patients, rather than just having them come to the clinic or the emergency room. If families are really concerned about getting testing, this is what we advise, to call the clinic, and also COVID-19 hotline. And again, it's very safe. It's super organized. You come to the site, you stay in your car, they take the swab, they get a nasal swab or nasopharyngeal swab, and you do not leave your car. And it's super well run and very organized. And you can get the information in about 1 to 2 days.
Thank you for that. We also have another question, and this is, I guess, to any of the physicians that see patients in their office. Do you offer masks to your patients when they come to the office, or is that something that they should be bringing themselves?
At Northwestern, we, as the patient enters the hospital, they are screened for a temperature to make sure they don't have fever. They're screened for certain symptoms verbally, and they're also provided a mask.
Yes, likewise at Lurie Children's Pediatrics.
Okay, fantastic.
I'd like to respond to that as well. On labor and delivery at both hospitals where I'm on staff, all patients must have a mask, even while in labor, which is especially important. And if they don't have one, we will provide one.
Okay, that's actually, we did get another question about women who are pregnant and if they're using masks in that situation and if the hospital is providing it. So thank you for answering that as well. And then another question that I had directed at Dr. Balark, but obviously the rest of you can answer. What sort of COVID treatments can you seek if you don't have insurance, or if you don't have insurance for your children? What is out there available to people?
So in regard to not having insurance, part of what helps to try and offset the cost of some of the COVID testing, well, first off, with testing, everyone can get testing, and testing is paid for. First off, if you have insurances, testing is 100% paid for. However, for those individuals who don't necessarily have insurance, the CARES Act, which is something that many of you may be familiar with, which is the Coronavirus Aid, Relief, and Economic Security Act, is an act that provides monies to help pay for and step in to assist those individuals who do not have insurance or the ability to pay.
Okay, thank you for that. Representative Ford, is there anything else that you wanted to ask?
Well, I know there was a question someone wanted to know about resources for children and virtual mental health awareness. You know.
Oh yes, I provided that. I gave 2 examples. The University of Washington on their website has some information on mindfulness techniques and goes in, but I'm happy to provide some more information on that. I just have those 2 examples readily available.
So thank you for that. So let's just answer the question that's critical, I think, as we move away from COVID-19, because one day it will be lessened. I do believe it will be lessened, and fewer people will have the coronavirus. But we still will be left with what Dr. Yancey and many of you doctors on here, all of you, I know, have talked about the healthcare disparities. And Dr. Balark, you talked about it. And I know Dr. Latimer and Dr. West, you deal with it just like Dr. Balark all the time, because you deal with Medicaid patients and you deal with individuals that have defense in front of them. So my question is, now that the light has been shined, where do we go from here? Where do we go from here if you are advising government and businesses and the community? How do we, as an African-American community and people that struggle with all of the pre-existing conditions, have better health, even when it's very difficult, because we seem like it's not affordable. It's not affordable to eat healthy because people think that you have to have a lot of money to have fruits and vegetables. I mean, can we get out of this or is this something that we're going to live with for eternity?
I do not think it's something we're going to live with for eternity. But just as the disparate nature of what's going on in our communities did not develop overnight, it's not going to get better overnight. But what I feel to be very important in this situation is that we do have the desire, the need, and the ability to want to try and help improve the state of our disparate populations. And Dr. West does serve along with me as well on the Lieutenant Governor Juliana Stratton's task force. And in addition to that Equity and Justice Task Force, there are many other task force and work groups that are actually springing up all across the country. And in the words of Dr. Clyde Yancey in the opinion he wrote in the Journal of the American Medical Association, perhaps COVID-19 has been that bellwether event that will change things for us in this country.
I'd like to add to Dr. Bell Balark's comments in terms of moving forward, where we go from here as we're reopening economies. We still have a huge virus problem, and that trumps, for lack of a better word, the economy problem. So we have to stay focused on the right here, right now, as much as we want to move forward. Better days are ahead. People ask about the second wave. We'll be prepared if and when there's a second wave, because we'll know to wear the mask. We'll know to socially distance. We got caught off guard with this first part. But if there's a second wave, we'll be ready. But for right now, we have to be present in this moment and do everything that we can to make sure that we are saving lives. We don't want to lose any one life that we could possibly save. I think that means testing, contact tracing, and isolation. With any infectious disease, that is the way you bring an end to it. You've got to test, find out who those positives are, find out their contacts, and then isolate them. So we need a robust effort right here, right now, in order that we can see those brighter days in the future.
And I'll just add, this is Tommy Latimer, I'll just add that as a pediatrician, I hope that leadership is really thinking hard on how do we get children back to school. How do we do that in a safe way? Because if children are at home, how do the parents, how are they able to go to work? And also virtual learning is okay, but we know that that cannot take the place of in-person, face-to-face learning. So how do we work on that? I know we can be creative and find a safe way to do so.
See, I want to thank all the doctors for doing this. I want to give a special thanks to Dr. Bell Balark for organizing this effort and bringing and introducing me to two fantastic doctors right here in Chicago. Thank you all for what you do. And we know that this is going to be just part one, and there's going to be a part two that Dr. Kimbra Balark has already start organizing, and that is she's already pulled together a psychiatrist, and that's Dr. Crystal Clark, where our focus will be on resilience, recovery, mental health, self-care, as well as the latest updates on COVID-19 testing, the importance of contact tracing, treatment, antibody testing, and the vaccination. And so I want to thank you for pulling that together for us, Dr. Balark. And maybe we should just make sure that before we go, that we give everyone closing remarks. And we'll start, of course, with, why don't we start with Dr. Joy West?
Thank you again, Representative Ford, for the opportunity to keep the pandemic right in front of our community. I want to just close by saying that we are in it, the Black physicians, we are in it to save our community, and we'll continue to do everything we can to make sure that our patients get the excellent care that they need. And beyond that, we'll make sure that our community as well, the voices of our community are heard. Thank you.
Thank you. And Dr. Latimer? Hold on one second, Dr. Latimer.
All right. Thanks again for this opportunity, Representative Ford and Corinne Bradley. I had a really good time being here. I knew Dr. Balark, but it was a pleasure to also get to meet Dr. Joy West. And as a pediatrician, I encourage parents to know that it's safe to go to your clinics, and let's please keep our children up to date with their well child visits and vaccinations. And please keep in touch with your physician, pediatrician, if you have any questions. Thanks for this opportunity.
And Dr. Balark?
And I am in 100% agreement with both Doctors Joy West and Tommy Latimer. Again, Representative Ford, I want to thank you so much for giving us this opportunity and this platform so that we can continue to reach our communities and to educate them, because as we all know, education is key. And as we move forward, we want to continue to support our communities in any way that we can. And again, thank you very much for the opportunity.
Thank you. And of course, Corinne, you have any closing remarks and any final questions that may be appearing?
Final questions, nothing from my end, but closing remarks. I did want to thank all of the doctors for sharing their knowledge with us. And I know that if any other further questions come in, we can reach out to you. This is the first of other webinars we can host just to make sure that the Black community has access to this sort of expertise. And thank you for allowing us to share this on multiple platforms and for just being so open and available to our questions.
Well, I mean, I want that to be the final say, but I still have to make sure that I make it clear today that Corinne Bradley worked very, very hard with the doctors. This has been done over a week or so, getting the slideshows together and the presentations back and forth. And Karina is a volunteer. So thank you so much for doing this, taking your time out for doing this today. And I'll leave it back in Karina's hands so that she could close us out.
Okay, thank you everyone for joining us. And we hope to see you again soon. Bye, everyone.
Thank you.
Thank you.
Bye.
Bye.
Bye-bye.
Bye, everyone.